So welcome everybody. This is our 3-hour seminar about treatment in schools and preschools for selective mutism. I'm Elizabeth Woodcock and I'm the director of the Selective Mutism Clinic in Sydney, and I'm also a clinical psychologist. So we have probably seen or supervised about 500 cases of kids with selective mutism since the selective mutism started, since the clinic started 10 years ago. And they've ranged in ages from about 2 years to adulthood. It's definitely much more common in preschool than it is in primary school, and it becomes even rarer as you get into adolescence and adulthood. So we've only seen probably a handful of people who are adults with selective mutism, but hundreds of preschoolers. So today, just to go through an overview of what I'm going to be talking about, I'm going to be talking about what is selective mutism, understanding it as an anxiety disorder, using step ladders as a treatment strategy to treat anxiety, why kids talking is selective when they have selective mutism. Why do they talk sometimes and not other times? And then a whole bunch of treatment strategies. This is school treatment strategies. So starting out, what things you need to put in place when you're first working with kids like this, how to educate all staff at the school to make sure that they're not causing harm or causing an increase in anxiety for these kids. Communication sessions, which are held with the teacher, the parent and the child, including a main technique called sliding in. Generalising talking to other teachers, other students, and eventually everyone at school. Building communication through step ladders, so that's in the classroom mostly and other school situations, and then the importance of using reward systems. So when we treat selective mutism, we have a three-pronged approach. We have the school, we have home program, which just means working on anxiety in other social situations outside school, and we have the clinic program. The school program is a really intensive part of the program, which requires the classroom teacher to be involved. And this is because selective mutism mostly presents at school. So they speak normally at home. We can get them talking to us in the clinic, but then it doesn't tend to generalise to the school. So that's why it's a very intensive program, unlike other treatment programs for other anxiety disorders. In the clinic, they're still having regular sessions, and treatment tends to take 1 to 2 years. So that's also quite different compared to other anxiety disorders that might only take 10 to 12 sessions. And the scope of the talk today is just looking at that school program. And we're just going to look at it in preschoolers and school-age kids. So most of the time when I talk about school, I'm also talking about preschool, and the strategies for preschool and school are very much the same. There's only ever some slight strategies that are different. So what is selective mutism? It's where kids just can't speak in some situations, such as school or at the shops or with family friends, where they're expected to speak, but they can speak normally in other situations. So they do speak normally at home. They're often described as the loudest kids at home, and we know that it is an anxiety disorder. What it looks like, there's a very large variability in terms of what it looks like. So they might sometimes talk to all the kids at school but no teachers. They might talk more easily to adults rather than the kids. They might whisper to everyone but just not be able to use their normal voice. You might see that they even find it hard to join in non-verbally and refuse to do work, refuse to join in sport and so on. So this is just a quick video. It's freely available on YouTube. It was part of a UK documentary about selective mutism, just to show you a little bit what it might look like at school.
Like school for me?
Yeah.
For me?
You like school? Yes. Do you want to speak in school? No.
Madeline Rains has a rare anxiety disorder called selective mutism. It means in certain situations she is quite literally struck dumb. Even Madeline's mum finds it hard to understand.
She'll talk when we're outside to me, so long as there's nobody that she sees that she recognises. If she sees anybody she recognises, she'd be quiet. She's quiet. But as soon as we walk into shops, she goes silent and won't answer. The exception is the supermarket. Okay, lemon slices.
You said Mr. Kipling.
It's actually as if she feels more at home there. She speaks in a louder voice.
Ellie's having those toys.
Okay.
No, I want to live long. Can we have 2?
2 each. What would 2 each be?
1, 2, 3, 4, 5, 6, 7, 8.
She'll speak to members of adults in the house. She'll speak to family members. She speaks to other children when they come here. But family friends, people that she's known really since as long as she can remember, she won't speak to them. And that's really strange. My brother, we only ever see him once a year, and she'll speak to him when he comes, but she won't speak to my friends that she sees every day because they're not family members. It just doesn't make sense, really.
I'm lost! That's don't fall off.
Madeline's rules are complex and sometimes contradictory. They are also very strict.
See? I blew up myself.
We've been filming with Madeline for a few weeks, but when we accidentally overhear her, it becomes apparent that we've broken one of these rules.
I'm sorry. I'm sorry. You didn't know we were there.
And we get a glimpse of just how distressed she can become when her code of silence is breached.
All right, sweetheart, give me a kiss. All right? Come on.
So that's just one type of presentation of selective mutism, and every type you'll find is a little bit different. You saw in the video there that trust is very important as well. So when you're implementing a treatment program at school, it's really important to be very open with the child about what you're doing and never trick them in any way. Because if you betray that trust, then it's going to be much harder for them to work on being brave and practice talking. So what do kids with SM say? So it's common that they'll just say, there's nothing wrong, Mum, there's not a problem. Some of them just shut down completely and have learnt not to talk about it. Some of them say, I'll talk when I'm 6. And some parents sometimes say to me, do you think they will? It's just a technique to get everyone off their back, so they won't suddenly start talking like that. It's pretty rare that that would happen. Most of them do want to talk, but they just don't know how to start. And generally, if they're asked, why don't you talk, they can rarely say why. However, we have a worksheet where we give them a whole list of reasons why they might find it hard to talk, and they'll usually go down that and circle yes and no, and give us an idea of some of the things they're worried about, which we'll talk about later. Here are a couple of quotes from some kids that we saw at the clinic. So a 5-year-old boy with SM said, my voice is locked in a box and I can't find the key. Said that to his mum. And then a 3-year-old girl said, I can't talk because there's an elephant on my chest. So just cute quotes. So more about SM. So it actually is a lot more common than people think. It's just that it gets rarer with age. But if you take a group of kids between kindergarten and 2nd grade, it's 1 in 140. So it's almost as common as autism. And that doesn't include preschoolers. So if you include preschoolers, it would be even more common than that. It definitely becomes less common as age increases. So for kids between 7 and 15, 1 in 155. So already a massive shift. It typically presents around 3 years of age. So if I heard of a child that had talked normally and then they had become mute at 8 years of age, I'd be very suspicious that it's maybe not SM, that something else is going on. It's very treatable, but as I said before, it does take a long time. And the prognosis, if it's left untreated, so some of the kids that we hear about in high school and they might start treatment and then not follow through, their prognosis is quite poor. So there's greater rates of unemployment, depression, and psychosis. So this is a video of someone who did have a little bit of contact with our clinic when she was very young, but she was part of our remote program. So she was living in Queensland at the time, and we recommended, we don't always do, but we recommended that they follow up with a local psychologist as well. So we can't take credit for all her treatment, but she wanted to make this video to show people just her experiences with having SM as a child.
Hi, I'm Felicity, and I had selective mutism during my primary school years. I'm now 14 years old.
What's something you remember about selective mutism?
I remember I was very quiet and shy. I felt scared, worried, and frightened to talk to people. I didn't really know why. I talked with everyone in my family and really close friends, just not people at school. I guess I didn't like office environments or being in confined areas. It made me feel pressured. In kindergarten, my confidence grew and I would chat to the kids, but when we moved to Brisbane, I became shy and didn't talk at all. As I got older, I began to talk to more people and I found it easier. I began to realise if I didn't talk, life would get harder for me.
Felicity, what helped you along the way?
Being slow and steady, not being forced or having the pressure to talk with people, and the support I received from many people. Also getting rewards from my parents when I talked to someone new. I also had afternoon and morning sessions with the teachers, which helped me gain my confidence with them, so I began to talk with them and many other students.
Felicity, what is something that you'd like to share with children or others that may have selective mutism?
Talking to people isn't as bad as you think. Just give it a go and you never know where it could take you. This reminds me of my Year 7 graduation speech, which I presented to many Year 7s and their parents, also teachers. It amazed people and left them speeches. I just set a goal for something and then did it. I felt I needed to do this speech, not to get the position, but to gain the experience of public speaking, and that it was better for me to learn and practice it now, opposed to learning later in life, when I might not get another opportunity like this. Just remember that talking isn't as bad as you think, and just give it a go. You never know where life could take you.
Okay, so the things that helped her might not necessarily help another child. So she found that it was easier to start ticking off names. Okay, I can talk to that person now, and now that person, and that was one way that she generalised her talking to everyone. And it also shows that being able to eventually speak in front of assembly is actually a realistic goal for these kids. So that is at the top of their hierarchy, and we'll talk about hierarchies later. Okay, so one thing about these kids is that selective mutism is a very complex anxiety disorder, and it's quite common to have other disorders alongside it. So one study showed these statistics. And interestingly enough, 55% of the group had 3 to 7 different diagnoses. That's massive. So we're not just treating selective mutism. Of particular note is the communication disorders. So research as a whole shows that about 1/3 to 1/2 of them, even though they do talk freely and comfortably at home, they still have a communication disorder as well, which is sometimes an articulation problem or an expressive language disorder. And so that probably then plays a role in making them more anxious about communicating. Things like wetting and soiling are quite common and to be aware of in the classroom as well. So it's not just about the mutism. You often see these kids have social phobia, so difficulties eating at school, going to the toilet, behavioural issues which tend to present more at home than at school, performance anxiety, so they might not want to do writing tasks or drawing or painting if they're in preschool, or joining in sport, self-esteem, social skills, assertiveness, so asking for help, even if it's non-verbally, they might find that quite difficult. Teasing and exclusion tends to start to kick in sort of later primary school when kids are less tolerant of their friends who don't talk. And depression starts to be very common in late primary school and definitely high school. So let's understand selective mutism. I want everyone to imagine their biggest fear. So it could be one of these. Mine is definitely that one, so you would never get me bungee jumping or going on a roller coaster. Could be spiders. So if your fear isn't there, try and get a picture of it in your head. And now imagine that someone is actually trying to make you face that fear. How it would feel if they're saying, this is really important, you just need to do this, pushing you closer to that fear. So I know if I was on a ledge with a bungee cord tied to my leg and someone was, forcing me to get near to the edge, I would feel extremely anxious, feel a whole lot of symptoms in my body, and I'd probably start to look quite stubborn as well. So that's something to keep in mind for a bit later on. So this is what it feels like for a kid with anxiety with selective mutism, but particularly at those times where they think there's an expectation on them to talk. If there's no expectation, that's not likely to get triggered. So quickly, what is anxiety? So there's some sort of trigger, which could be a real threat or a perceived threat. So in caveman days, I'm sure a saber-toothed tiger would be a very real threat. That triggers your fright-flight response in your body, which gets you ready to either run for your life or stay and fight. And what that feels like in the body is you'd get a hot red face, your breathing rate goes up, sweating, tight muscles, needing to go to the toilet. Your mind is focused on that thing that you're thinking is the threat. Mouth goes dry because your digestion is slowing down, racing heart. The butterflies and nausea are also part of that digestion slowing down, and shaking and trembling. So it's a very strong physiological reaction, and for kids who don't understand anxiety, that's really scary, and they'll do what they can to avoid it. So if kids with SM have felt like that, their shutting down is their way of managing that anxiety. So what are their worst fears? So their fears are things like, people won't like the sound of my voice. It sounds different, or it sounds like a boy's voice if it's a girl. People will pressure me to talk, or they're going to act they're going to act surprised, or they're going to laugh at me. So lots of different fears, and it's not just about people's negative reactions, it's about positive reactions as well. What triggers anxiety? So let's say a teacher says, "Hi Sam, how are you? Can you say hi?" Already there's that expectation to speak or pressure to speak, which then triggers the child's worries about what's going to happen if they talk, how people will react, their fright-flight system gets activated, and then they shut down. Their own anxious thoughts are another trigger. So you might not be doing anything in particular, but they're sitting there thinking, they're going to expect me to keep talking if I do say something. They'll think my voice sounds strange. I've never talked at school. What will they think if I do talk? They're going to be really surprised. So for a child who hasn't talked for quite a long time, there's then that fear of, I haven't talked for so long, how are people going to react? And they also fear positive reactions. So, wow, Hamish, I saw you talking all the way from the other side of the classroom. I never knew you could speak. That's fantastic. That's their worst fear, that you'll have that big response because it causes the embarrassment, and they don't want that embarrassment. They don't want any attention drawn to them, so they then shut down. So I once worked with a child who had come to us in second grade, and the parents said they haven't talked since kindy. They did talk for the first time in kindy, and the teacher rushed over to them in the playground and was really excited that they'd talked. I have sort of visions of the teacher kind of bounding over the chairs and, embracing this child. And the child went home and said to their parents, "I'm never going to talk at school again." And they hadn't between that period of kindy and second grade. So it's very easy for it to get entrenched once they've already got that history of difficulties talking. But they can look really relaxed. So if there's no expectation or pressure to speak, so walk into the classroom, teacher says, "Hi Sarah, it's great to see you today, let's get started." Then no anxiety is triggered. They've learned to trust that environment, and the child looks calm, relaxed, happy, and they can join in activities. So that's great, but then that does cause some issues because they can look stubborn. So if you've got that type of child who looks even gregarious in the classroom, not saying anything, but moving around, joining in, they almost look like they're talking to people because they look really animated, but then if you ask them a question, they're just blank and don't say anything, then you can get that perception easily that they're being stubborn. And also because their communication is quite variable. So one day they might talk and answer a question from you, but the next day they don't. And sometimes that's confusing. And you might think, well, I know they can talk, so they must just be being stubborn. It's really important to know that there might be that element of control or stubbornness, just like if someone tried to make me bungee jump, I would look very stubborn. But that is because of the anxiety. It's not a behavioural problem. And any kids with behavioural issues solely, it's an externalising problem, and they're not going to be able to stay mute for that long. They just wouldn't be able to help themselves. And it's also not useful to view it as stubbornness because it makes us feel frustrated, and we're more likely to increase the pressure and the expectations on the child to talk, and also more likely to give consequences, such as, well, once you ask for your work, then you can go out to the playground. And we know that consequences like that actually entrench the mutism more. So they all increase anxiety and just lead to more of that. So what causes SM? We know that there's no more trauma in these kids' lives than in the general population. So it's not specifically due to trauma. It is due to anxiety. And there's a combination of genes and environment that cause the mutism. So there's a very strong family history of anxiety. So about 70% of first-degree relatives, so that's parents or siblings, have an anxiety disorder, like have social anxiety. And about 37% of those first-degree relatives had selective mutism. That's really high. So when the research looks, really carefully into the parents' backgrounds, it's quite common that they would have had selective mutism. And anecdotally, generally, we find both parents are quite shy or socially anxious. Then environmentally, the kids tend to have less social experiences, so less play dates, less having people over to the house. Activities might tend to be more things like ballet rather than really noisy music classes where they get to talk and socialise. They tend to have more changes of school and house, so those multiple changes end up setting them back each time. And then, in my opinion, they have more things that make them more self-conscious about talking. So people in their lives that have either shown those positive or negative reactions to them talking. The speech problems make them more self-conscious about talking. And bilingualism, so about 28% of these kids are bilingual. And I think there's an even greater proportion of kids who aren't bilingual, but their parents speak a second language, and they're exposed to their parents' accent, they're exposed to people sometimes not understanding what their parents say. So all those things are just making them a little bit more nervous and self-conscious about language. And then what keeps it going? Ineffective strategies, pressure to talk from either school teachers or parents or relatives or grandparents, unrealistic goals. So a child might need to just work on non-verbally nodding their head, but someone might be trying to get them to say a single word, which they might think is a small goal, but a single word for a child at the beginning of treatment is a big step. And then avoidance keeps it going. So the child avoids by not talking and avoiding going into situations like playing with their friends or going to birthday parties. Others help them avoid by talking for them or saying, oh, they don't talk. So you might hear kids in the class say to the relief teacher, oh, they don't talk. And suddenly they've let the child off the hook. Or an absence of treatment. Sometimes we have a wait and see approach where, well, we don't, but sometimes people say, let's just wait and see if it resolves. And it generally won't. Often the absence of treatment is because people are worried about doing the wrong thing and making it worse. And sometimes it's really hard. The parents don't want to distress the child because treatment does involve making them face their fears and being anxious. And then finally, not talking becomes a habit. If you're in 5th grade and you have never talked since preschool or ever in that sort of environment, then it's just become so habitual and the child just doesn't know how to get out of that. So how do we treat anxiety and fear? If you've heard about treatment of other anxiety disorders before, you know that we have to face the fear for the anxiety to go away. So their brain needs to learn that the thing that they fear, talking or spiders or bungee jumping, isn't life-threatening. And the only way to learn that is to face the fear. So let's consider you've got some sort of trigger. So it could be spider or it could be talking. Anxiety is triggered. That feels uncomfortable, so we then avoid it. That feels better. I've avoided that spider or whatever it was, and my anxiety's gone away. So then we tend to just keep on avoiding. If we don't avoid and we stay in that situation that we fear, that's called exposure, and our anxiety will eventually go down. And the brain learns that, okay, I didn't like that, it was pretty uncomfortable, but I didn't die, I'm still here. And so every time you're exposed to that same trigger, your anxiety comes lower and lower and will eventually either go away or be pretty minimal. However, we can't get a child to talk. That's at the top of their hierarchy. So we have to take gradual steps. We still do exposure. We get them to face that fear of communicating, but it's very gradual. And same with other anxiety disorders as well, not just selective mutism. So that's where step ladders come in. So what do step ladders look like? Let's just take something different to start with. So a really typical anxiety that these kids have is eating at school. So a typical step ladder might look like eating grapes on their own in the classroom, no one else about. Then eating grapes with a friend in the classroom, eating grapes with friends in the playground. So you're changing one variable at a time. Eat one bite of a sandwich with friends in the playground. So these kids might be worried about getting the crumbs on their mouth. So the grapes were easy to pop in. The sandwich is a little bit harder because there's more risk of it being messy. Eat a sandwich with friends in the playground, like more of a sandwich, and then eat a normal lunch with friends. Now, in reality, a step ladder would need many more steps than that. So it might have 10 to 15 steps for anxiety with eating. Some kids might need less, some might need more. So now, how do we make a step ladder for communication? So our clinic has developed a 5-stage model of communication. And I'm going to go through this pretty quick because I'll then go through each step quite slowly. So stage 1 is what we call pre-communication. Stage 2 is talking to someone they can already talk quite freely with, like a parent or a sibling or a good friend, but in the situation that they feel anxious, so like at school. So Maddie, in the video, when she was talking to her mum in the supermarket, that is stage 2 talking, because she would normally be anxious in a supermarket around other people, but she's practiced that enough to get really good at that step. Stage 3 is non-verbal communication. Stage 4 is a step we call indirect communication, and then stage 5 is directly talking to someone. And again, it's not 5 steps and you're done. So there's sometimes 50, 60, 70 steps within that 5-stage. So let's go through each stage in turn. So pre-communication is where children it's regardless of communication, where they just find it hard to do what they're supposed to do, hard to join in, hard to be in the right place. So one child's not doing their work because they're feeling anxious, one child's not separating from their parent and going into the school line-up line, one child's not joining in play with other kids. And when it has been achieved, they're doing things like playing with their friends in the playground, doing their work, sitting on the mat during group time, paying attention and listening. So it doesn't involve any non-verbal or verbal communication. It's just doing what they need to do. And this is a really important stage, because if a child's not in this stage, if they're struggling with some situations like not joining in sport, or one child I'm working with at the moment can't reach out halfway on her desk to grab something, she's that anxious. So the stage is important because it's really unlikely you're going to even get non-verbal communication from the child if they're still in pre-communication. And we'll talk later how to work on that stage. Stage 2, what does this look like? So they could be talking to their parents in the classroom, not talking to you, the teacher, but talking to their parents. That's stage 2. Talking to a friend in class at their desk, given that that's a child they normally can talk freely to, but if they're talking to them at their desk, that's stage 2. And talking to the teacher is the last, the last one is talking to their parent in the classroom when they're alone. So they've achieved stage 2. Stage 3 is non-verbal communication. Now keep in mind that non-verbal communication is a very broad category. We don't want them just nodding and shaking their head. We want them to be able to type, write on the smart board, put up their hand, younger kids to put up fingers for numbers, pointing to reading as you're reading a book, so you know they're reading because they can keep where they're up to, or just writing down things for you. And the sort of things that you want to work on in non-verbal communication is not just getting that range of responses, but for the child to both respond and initiate that communication. So if you asked them a question and they nodded or shook their head, that's responding. But if they put up their hand to ask for help, that's initiating, and that's important as well. You want to see relaxed movements without any delay. So sometimes when I first work with kids and I ask them a question, I get a nod, but the nod's so tiny, I can sometimes hardly tell if it was a yes or a no. So you need to keep on working until it's really big nods. And shrugging for I don't know is a good one to practice as well. Keep in mind that greetings and manners and eye contact are really difficult types of non-verbal communication for these kids. So you could even drop working on those and leave them till sort of last in the program. Indirect communication, this is the stage 4 that I talked about. We find that kids with SM just don't move easily from non-verbal communication to directly talking. So this is where a lot of people get stuck. So that's why this stage is quite important. There's 3 types of indirect strategies. One is using a talking buddy, like a parent or a friend, where they look at the friend and they tell the answer to the friend and the friend relays that to the teacher. Great if they can do that, so that's quite a sophisticated level of communication. The second type of indirect is using augmentative devices or recording devices. I'll talk about some in a moment. And the third type, which you'd probably only use with preschoolers or kindy kids, is building sounds to make words. So they might be able to make a yes and then eventually roll them into a yes. So it's a slow process, but that has been quite effective with some kids. So what does that stage look like? So you might have them record something at home on their mum's phone and then bring it into you and play the recording. You might have them send a voice email. The Iron Man mask is you press a button and it changes their voice as it comes out the speaker. So there's some really fun ways of masking their voice, like the megaphone as well. Can mask their voice and it comes out like an alien or a robot's voice. Walkie-talkies are a great fun way also of practicing indirect communication, and the telephone, talking on the telephone or leaving a voice message on the telephone for a teacher or a grandparent. And then the child whispering in class, that is indirect. If the teacher had asked the child a question, the child tells their friend and the friend tells the teacher. If it's just talking to their friend, then it's stage 2 talking. There are some really good apps that you can use when you're working on this type of communication. So there's an app for Android called Voice Memos, or another one called Easy Voice Recorder, where you can record different phrases and the child can press or the child records home, presses play in class to ask for different things and get their needs met. So there'll obviously be an age where the child gets too old for this and it's too embarrassing, but we have had kids use this up to 4th and 5th grade. So for iPhone, the equivalent is Quick Voice, and I'll just show you what it sounds like.
I don't know. Can I have some help, please? Good morning, Miss Lucas. I finished my work. Can I have a drink, please?
So the success of any techniques like this really comes down to how much it is worked on and implemented in the classroom. So I've had teachers work very successfully with things like this, where the child can only communicate non-verbally, they can't communicate verbally at all, and they're needing some sort of indirect strategy like this. And even the child's friends have sort of encouraged the child, you know, come on, say, you know, use your iPad to tell us what you want. Lots of positive encouragement. If it's too hard for them to play their own voice, you can just record the teacher's voice or the parent's voice to start with, and it's still getting them used to the process, and then over time they can then start to record their voice. And then there's text-to-speech apps. So this is where you have an app. This is great for adolescents, older kids, but the younger ones can do it as well. And I've even worked with adults where they've got out their app and they've typed things and pressed play, and then it's said what they've typed. So it's sort of a bit Stephen Hawking style. I'll give you an example.
Could I have the next worksheet?
So they've typed, can I have the next worksheet? Press play. And that is better than you just reading what they've written, because if you read what they've written, it's non-verbal, so stage 3 communication. If they play, even though it's not their voice, it's starting to do more communication direct to you, and so we'd call that indirect communication. And there's ideas there of what you need to type in the app programs too. There's tons of them to actually find relevant ones. And then finally, there's voice changing apps. So many children are too scared to record their normal voice on, say, mum's phone and play it to you. So an intermediate step is using an app where they record something and then they can press different buttons and make it sound like they've just sucked in helium or an alien or a robot's voice. And there's tons of apps again. There are a couple of examples for iPhone and Android. One of my favourites is called Talking Tom. So this is my voice.
Hi, Mrs. Peterson. This is Jenny. I just wanted to let you know that I have a cat called Kitty. Do you have any pets? Okay, that's all. Bye.
Okay, so a great fun way of starting to communicate with the teacher in more sophisticated ways than non-verbal. I won't go through all these steps, but this is just to give you an idea of using video and audio recordings to expose a child's voice to you. Kids will really vary with where they're able to start on this hierarchy, and there's actually 16 steps on this hierarchy. So some kids, when you suggest making a video recording and playing it, particularly the younger ones and the preschoolers, will happily go home, they'll record themselves dancing and singing, and then they'll come in and they'll let you play it to the whole class. That's the top of the hierarchy, and they're already there. Other kids, so I'm working with one child at the moment where it's even been hard for the first step, which is recording the family's voices at home without them even saying anything. So it's actually a step they can't really refuse. That's why it's the first step. Mum and dad both say, "Hi, Elizabeth," on the recording, and mum brings it into me, presses play, and I hear them. And then the next step is where the child does join in, but you can't hear their voice because it's too soft. And then so on and so on through the steps until they can do things like playing a voice recording of their news and present it to the class. So this is also a technique that you can use to get them to do classwork. So it sort of suits those academic needs as well, but it's a therapeutic technique to eventually get them talking. Some things to think about with recording devices is that trust is absolutely paramount. So you need to tell them that only you will listen to this. Best if you even hand it back to mum so they know it's going home with mum, because they'll be worried about you playing it to other staff members. So even though they might never know, I would never sort of go along and say, hey, you know, listen to this, you know, we've got a recording of so-and-so's voice. It's just not worth it. And I've sometimes parents at an assessment will say, I've got a video of them talking, do you want to see it? And I always say, no, I don't need to. Like, you can tell me what their talking is like, and I'll eventually hear them talking later on when we work on the hierarchy. As I said, there's a very high variability in how willing they are to play audio recordings, and it's very common for them to refuse completely, so don't give up. Just keep on persisting and start on that very first step. Look for avoidance. So they can still have very subtle avoidance behaviours. So you might be watching the video recording and they're kind of doing this and not looking. So you actually really want them to be looking at your reactions, because you want them to learn that you're not going, oh my gosh, you know, that sounds awful. They're learning that you're hearing my voice and nothing bad is happening. And they need to listen to the sound of their own voice as well. And when you do hear a voice recording, let's say of them talking about what they did on the weekend, you can praise gently that you've been really brave, you know, playing this voice recording, but also comment on what they've said, just as if a child had spoken to you directly. So using talking buddies, so this is still stage 4 talking. If they are, some kids also can readily already tell their talking buddy something and the talking buddy will tell you. Other kids can't do it. So you need to use a little bit of a hierarchy to make that happen. So you might say something like, if they're ready, this is, so if a child's in pre-communication or, you know, not even well in non-verbal communication, you wouldn't use this strategy. But if you think they're ready for stage 4 communication, you might say, Josie, I'm wondering what you got for question 1. Can you tell Peter? And I'll just come back. So you walk around the classroom, you come back, and then Peter tells you what Josie had said, hopefully. If they haven't, then you need to rethink. Maybe that was too hard a goal for them. So then there's lots of different steps, which I won't go through, where you then, you're not walking away so far, you're then increasing the chances that you can hear their voice. So if they're cupping their hand around their mouth, then you get them to put their hand in their lap, more distance between them and their friend's ear, and eventually they'll still look at their friends, but you will start to hear what they say. And that's a really important part of treatment, because you can then jump in and respond to them before their friend repeats what they say. So she looks at her friend and says "too," or even whispers "too," and you go, oh, great, yeah, great telling me too, and let's move on. So they've then learnt that the teacher heard my voice, nothing bad happened, and you can keep providing more and more practice doing that. Younger children, by the way, can, when I say younger, I mean preschoolers. Don't try this with an older primary school kid, but they do like using puppets as a whisper buddy. So tell your puppet, tell your whisper buddy. And we've talked about that, and eventually they'll start to direct speech towards you. Stage 5 is direct communication, and so my catchphrase at the clinic is it's not over until the selective mute sings. Meaning there's a long way to go even in stage 5. We want to get them to the stage where they can talk at assembly, or at least do their news in front of class. So what does it look like? It looks like talking to kids that they haven't talked to before, talking to the teacher, doing performances, getting up on stage, even whispering directly to someone they didn't talk to before is an early stage 5 technique, and talking in groups as well. Another stage 5 strategy is to increase the child's volume. So if you're worried about the volume and you want to work on that as a goal with a child, you can get them to trace around their hands, label the thumb as number 1 and say this is a soft whisper. Number 2 is a loud whisper. Number 3 is using your vocal cords but very low, and you can give them an example of that. Number 4 is still using your vocal cords but a little bit lower than normal talking voice. And number 5 is a normal talking voice. And you can joke about number 6 is like the voice you use at home, which is a shouting voice. So this can then lead into goals that you're working on with the child. So you might say that again using a number 3 voice. So this might be a child who'd been whispering a lot and you're starting to get their vocal cords out. And so you're working on not a number 5, but just a number 3 voice, which is an achievable goal for the child. Then there's some really fun apps that you can use to increase voice volume. And I have been very surprised at how well these work. So kids who are really anxious, who I didn't think would even try and talk louder, have been almost trying to yell, not that it's come out as a yell, but for them they're pushing so much air out of their mouth, trying to increase the meter on the app on my phone. So it records their average volume and the highest volume. So just search apps for sound level meter and you'll come up with tons of those. All right, so moving on to a different section, understanding why they're talking is selective. So many different factors in the school environment will increase the child's anxiety and then cause a greater level of mutism. If you can understand these, this will really help you in the classroom to not only understand why they're mute or why they're talking more easily, but to set goals to help them move forward. So if there's less talking, assume there must be some variable, even if you don't know what it is, that's causing them to be more anxious. So here are some of the variables. So someone might say, why do they talk to their parent but they stop when they walk in the gate? This one's more of an obvious one, but the parent is obviously very familiar, and the school is the phobic stimulus. School is scary to these kids. Why did they say hi yesterday but not today? That could be so many different things. But in this example, yesterday maybe their talking buddy was right next to them, and that reduces their anxiety. But today, the talking buddy is a few metres away. So it could be something as simple as that, which makes it easier or harder to talk. Why do they talk loudly to their friend at their desk, but they can't answer me? Well, again, that's quite logical. The friend is familiar, they trust them. You are less familiar, they haven't yet learnt to trust you. They don't know how you'll react if they do talk. Why could they use the smartboard before recess, but not after? So it could be something just like only 2 people were watching them before recess, and after recess, the whole class was watching. Why did they speak in front of the class yesterday but not today? So these are for those kids who maybe have spoken once or a few times. The times when they do first start speaking in whole class situations is when you're playing a really fun, engaging game where they've only got to say one word, like bingo. It's really predictable and it's fun and they really want to win the game. So bingo just comes out and then you think, oh my gosh, did they just speak for the first time? Whereas the other time they didn't speak, well, it could just be an ordinary academic task, or even harder, you've asked them an open-ended question and it's got personal content. What did you do on the weekend? Which is really scary for kids with selective mutism. Let's look at some more factors that affect their communication. So we call these external factors because they're things external to the child. One is the gender. So not always, but generally it's easier for them to talk to the same gender, and you'll find it's harder to talk to the opposite gender. If there's an expectation to talk, that's harder. I hope you enjoyed the movie. I've seen that myself. The Little Beaver's so funny. So the teacher's just chatting to the child. There's no expectation to talk. In particular with the preschoolers, you'll see a little bit more flexibility here around their communication, and they're more likely to jump in and go, oh yeah, or something like that. Whereas if they're asked, what did you think of the movie? So there's that expectation. I've asked you a question, I expect you to talk. They're more likely to just look at you blankly and not say anything. The type of prompt you give them, so when they are starting to talk verbally or even non-verbally, if you give them a specific prompt with what to say, it reduces the cognitive load and they're more likely to be able to talk. So you're at the canteen and you say to them, say orange juice please. They're more likely to say orange juice please. And if you just say, what do you say? Or your turn now, that's harder because it's a more vague prompt. So to start with, you might need to manipulate these variables to make it more likely that they'll talk. But later on, when they can do that, you want to manipulate them the other way to make the situation harder. So a child who can repeat orange juice please at the canteen, you then want to make a vaguer prompt. So what do you say? And then you might want to make it a non-verbal prompt. So you might want to kind of just a gesture or raising your eyes. This you're never going to know, but if they have had, well you might know, but they might have had just a difficult morning getting out the door with everyone rushing around, trying to get ready, people have an argument at home, and they come into school a little bit more moody and stressed. So just like all of us, we don't feel great when we're stressed, so it's harder to talk when they're feeling like that. And if you make things fun and muck around, quick, let's scrunch up the paper and throw it in the bin and say done, that's much more likely you'll get them to talk rather than say done. Using rewards and motivators we'll talk about later, but they are essential for helping these kids to progress. So whisper help please to your friend one more time, and then you'll have 10 points and can go on the computer for 10 minutes. Much more likely to get them to talk than if you just say, whisper help please to your friend. You won't always do the fun, motivating way, but it's just something to keep in mind. And eye contact, generally it is much easier to talk if someone's not making eye contact with you. I'll show you a segment from a session that I had with a client later on where we just sit side by side looking out towards a book or the resources, and I'm not looking at her. And harder if you are making eye contact. And other external variables that affect communication are transition times. So just coming right into the classroom, just moving to a different classroom, or breaks in contact. So Monday morning will be more difficult, start of the term, and every school year they will always go backwards a little bit with the new teacher, but then hopefully regain quite quickly. Then the type of communication that you're requesting from the child also affects how much they're likely to talk. That could be the length of the answer you're requiring. So one word or help please is easier than can I have help with my work please. Again, you'll manipulate that to start with to get them talking when they're in that stage, but later you'll expect that it will be a longer sentence. So later you'll manipulate it the other way. So child says help please, and you'll say remember we're working on whole sentences, so say that again using a sentence. Or if they can't do that, you might then need to use the prompting where you say can I have help with my work please. So that's using that specific prompt strategy. Voice volume. So it's generally much easier for them to whisper or use a low voice. So harder if the teacher says, Ellie, say here, I can't hear you. Rather than Ellie, you can whisper here if you like, if you know that that's easier for the child, and if that's the stage that you're working on with the child. If you're working on voice volume and you're working on vocal cords, you don't want to use that as a strategy because you're going backwards. And then sounds versus words. Don't do this with adolescents, but with preschoolers, maybe kinder kids, but probably not older. What sound does a cat make? What sound does a truck make? That's going to be easier than them actually saying words. What's that animal? And pointing to a cat. This one I've got a video to demonstrate because it's quite a complex sort of idea, but if something is very structured, like counting or reading, it's much easier for them to talk than if it's a spontaneous talking or an unstructured game. So count to 10 is easier than what did you have for breakfast? So I'm going to just play you a video of a client, and I've got permission to play this video. So this boy was a client at my clinic where he could talk quite freely to his aide, and he's talking to her here, and they've rehearsed some questions and answers for a talk that could be presented to the class. And so they're rehearsed, but then the aide throws in a question that wasn't rehearsed. So have a look at what happens.
What is your favourite toy?
My favourite toy is playing on my DS.
What is your favourite movie?
My favourite movie is Inside Out.
Oh, what's that about? I haven't heard of that one.
So you can see the shutdown mode starts, and they would have probably stayed there forever and you wouldn't have got a response. So it was an unrehearsed question, it's not structured. He was quite happy saying the rehearsed questions, but cognitively, and you know, he wouldn't probably have been able to formulate an answer to the last question because he's too anxious and thinking, oh, we didn't rehearse that, what would I say? Will that sound good? I'm not sure about that answer, it might sound silly, and so on. And then when a child does start talking, when they've started directly talking to you, we use a technique of using forced choice questions. They are much easier than open-ended questions to answer. So you can see they got 7 for a question, and you say, did you get 5 or 7 for that question? It's much easier for them to say 7 rather than, what did you get for that question? And facts versus opinions. So what's the name of that superhero? As long as you know that's an easy question and they know the answer, that's going to be easier than saying, what's your favourite superhero? Because as soon as you ask for favourites or personal information, they're going to be worried about whether you think that's a good idea. Well, you think I'm really babyish because I still like Superman. I don't think I really want to tell you what my favourite superhero is. Okay, we're going to move on to the components of the school treatment program. Obviously, all of those things you still take into account in the treatment program, and it's really important to have those as a basis. But these are now the main components. So we'll talk about starting out strategies. We'll talk about how to educate all staff. So going back to the school and pretty much educating everyone who might have contact with the child. Communication sessions that the teacher and the parent and the child will have. How to generalise talking. So once they're talking to you, how do you get them talking to everyone else? The other kids in the class, in front of the whole class, the music teacher, the library teacher. Using step ladders inside the classroom and using reward systems. So, starting out with the starting out strategies. Just a bit of an overview. Ensure the family are receiving treatment. So in most cases they are, but there's many cases where kids with selective mutism are not seeking treatment. And you shouldn't just be working with the child alone at the school trying to do these things. So it's like if you identified something like autism or ADHD, you'd be getting the family to follow up treatment, and you'd probably keep escalating it to different levels until the family did seek treatment. So it really is, it's a disorder which is hard to treat, but it does resolve, and the child can, you know, live with pretty low levels of anxiety. Apply for funding support. I'm not going to go into detail about that because I know how hard it can be because it's categorised as an anxiety disorder. But I've heard that some schools can successfully get it, and it depends how hard you argue about the level of support that these kids need. And it's nothing like, you know, a child has a spider phobia or even OCD. You don't need to do that much in the school to treat it, but for selective mutism you do. We want to reduce their anxiety as much as possible through really good orientation strategies. That's obviously only relevant for kids who haven't yet started at the school. Building rapport with the child, making sure they're very comfortably socially and playing with friends, prioritising the pre-communication stage, and educating peers. So that's just our overview to start with. So to start with orientation, I generally recommend to start transitioning strategies in term 3 of each year. You want to start to familiarise the child with their new teachers. I know you won't know who the teacher will be at that stage, but you might know generally, if the child's in year 3, you might know who's probably going to teach year 4. And it doesn't matter if you don't have it exact. And whatever the child's stage of communication is, if they're still non-verbal, you'd go and expose them to those teachers, delivering notes to those teachers. Or if they are verbal at that stage, they'd be working on verbal goals with all those teachers. And then as it gets narrowed down in term 4 and you start to get an idea of who the teacher might be, they can start to become involved in your communication sessions. You can send the child to their classroom to do verbal communication, or again, they might not be up to that stage, so they might work on non-verbal communication. Or delivering notes that say, "Can we borrow your sticky tape, please?" So just making up situations where they can practice getting familiar with the new teachers. Part of orientation is making sure they're very familiar with all the routines of school and preparing them for any changes, like a relief teacher, excursions, and so on. Because you want them to know how they're going to cope in those situations with not being able to talk. Camps are a big difficulty as well, but even things like athletics, carnivals. And devising ways for them to get their needs met in each class. So this is not even working on treatment strategies. This is just, how's this child going to tell me they need to go to the toilet? Or how are they going to ask for help when they need help? And there are very imaginative ways that teachers have come up with that don't embarrass the child. So this is for an older child, but if they want a child to express worries or concerns, they get all the children to write down those worries or concerns in a worry jar, and then they can read them. Or just checking in with the child regularly and asking if there's any concerns they have, and getting them to write or communicate in whatever way they can. So the next stage of starting out is building rapport with the child. So this could be if you're going to be receiving a child into your year the following year. So this would be term 3, term 4, where you'd start to have some one-on-one sessions with the child. And this is purely building rapport. It's not working on communication at all. So you want to play fun activities, lots of chatting from you as if there's a running commentary on what you're doing, not asking any questions at all, using self-disclosure and humour to help them relax, and continue with those sessions until they appear relaxed. If you already have a child in your class right now and you haven't been using any treatment strategies, I'd still be doing a couple of those sessions, maybe 1 or 2 15 to 20 minute sessions, just to help them learn to play with you and be relaxed and join in a non-verbal way. So something like is a really great game to play. So I'm going to show you a video of how you might, first of all, talk to a child when you first start to address their selective mutism, and then how you might go about playing a non-verbal game with them. So this is a role play. It's unfortunately not a child with selective mutism. It's my son trying to do his best to act like an anxious child. I am acting as the parent, and Simone, who's a clinical psychologist, is acting as the therapist. So this pretty much can be transferred exactly to the parent, the teacher, and the child in the classroom.
Hi Leo, my name is Simone. I'm a psychologist, which is basically just a helper for kids. And my job is to help kids be brave. And I know Mum brought you to come see me because I hear at times it's tricky to use your voice. And I see lots of kids similar to you, and I can tell you that things will get a bit easier while we're working together. So today what we're going to do is we're going to have some fun together. We're going to play some games, get to know each other. I'm not going to expect you to talk to me, so you don't have to worry. What we're going to do is I have a sticker chat for you, and maybe if you can do a good job of joining in, playing some games, what we'll do is we'll earn some ticks, because I hear you really like Beyblades. I had a chat with Mum, and we've drawn up a reward menu for you. So if you can fill up your chart, what we'll do is maybe we'll earn something on this menu. So we've got watching a movie on TV, playing Beyblades with Mum, ice block after school, bike riding on the weekend. So have a look, and maybe you can point and tell me what you might like to earn today for being brave. Beyblades with Mum for 30 minutes. That sounds like a really good choice. How fun. Okay, so what we're going to do now is we're going to play a game of Uno. And you're going to earn some points for doing some great joining in. So what we might do is, when we land up with one card, instead of saying Uno, we might just do a little finger point. Okay, let's start playing. Alright, so Mum, as you remember, we're going to be practicing the PCIT method as we're playing. So while we're playing, both me and you will just keep praising what Leo does. We'll describe what he does. We won't ask any questions, and I guess no commands or instructions.
Okay, got it.
Okay, so let's start playing. I guess I'll go first. I'm going to put a green 5 down. Mum, I guess it's your turn.
Change the colour and change it to yellow.
Great job. Okay, Leo, it is your turn. Okay, great job picking up. That is excellent. Okay, then I guess it is my turn, and you said yellow, Mum, so I'm going to pick up.
Yeah, good watching us play, Leo. I'm going to put down a yellow 0.
Okay, Leo, I guess it's your turn. I wonder what you're going to pick up. I wonder what you're going to put down, actually. Oh, we're picking up again. That was excellent picking up, Leo.
Very brave playing.
I'm going to put down a red 0.
Okay, and a red 7.
Leo, it is your turn.
I like how you're joining in, Leo.
Yeah, that was excellent, Leo. Good job. I'm going to skip Mum and back to Leo. Red 9. Leo, you're doing such brave joining in. I think that deserves a tick for your chart. A red 3.
Oh, and I'm going to pick up because I don't have a red.
Okay, so we've changed the way we do things at the clinic. So normally when we would first meet a child, we would be asking a lot of non-verbal questions and trying to see how well they can non-verbally communicate. So getting nods of the head and so on. So we're copying or following some of the new techniques that are being used in the US with these kids. So the rationale is every time you ask a non-verbal question like that, you're reinforcing that idea that they don't have to use their voice. So you're reinforcing the mutism. So even though you might use non-verbal techniques in the classroom, when you're using this technique and then moving into sliding in, which is where they start talking to their parents and you slide closer, we're not asking them to respond non-verbally at all. So the only time Simon did was point to what reward you like, because we wanted to choose a meaningful reward for them, and he would have been highly motivated to choose a reward, so therefore that would be a lot easier. So some games that you can use are pretty much any fun games, non-academic games that don't require talking. And if they do require talking, like at the end with you know, you need to say you know, you can introduce that non-verbal signal, like putting your finger up. So Build a Beetle, that pirate game where you stick the swords in, Jenga, hanging monkeys on a tree until it falls down, and snakes and ladders. So more starting out strategies. So you need to talk very openly about selective mutism and how you're going to be helping the child. So they feel really anxious when anyone talks about anxiety and talking, and we need to convey to them that this is just a really ordinary thing about and you feel totally comfortable. So the sorts of things you can say as a teacher are the same that we would say as a clinician, and that is, I know it's hard for you to use your voice sometimes, and that's okay. I know there's other kids at schools who find it hard to use their voice. Kids usually can't explain why they can't use their voice and they feel stuck with getting started. And I have some ideas about how we can get unstuck. Things won't always be this way. So you're giving them hope that things will change. You can communicate with me for now in whatever way you feel comfortable. So if you had a child coming into your class who can whisper to their friends and the friend goes up to you and says, oh, so-and-so wants some help, then let them do that, because that's an early stage 4 method of communicating. You would say if you can join in the activities, nod or shake your head and point or type on the iPad, that would be great. So you're just letting them know some examples of ways that they can communicate that you're okay with. We'll just take small steps doing brave things, and one day talking will be much easier. The tone that we use with these kids is very important, because it's great being empathic and warm as a teacher, but that doesn't always cut it with these kids. So on the one hand, you need to be supportive and understanding, enthusiastic, not show frustration ever, and be playful. But you also need to gently push them to face their fear. So I have worked with kids before who've had beautiful teachers who've been very empathic, but the child hasn't moved forward because the teacher's been a bit worried about making the child anxious. So a really upfront, matter-of-fact approach, quite firm but nice, conveying the confidence that they can do these goals, as long as you're picking goals that are appropriate, and direct. And this balance tends to work really well with getting them moving forward. So I'm going to show you a video that demonstrates that tone. So this is me working with a child with selective mutism and some comorbid issues as well in our session. I have permission to play this video, and it's just a short video to show you that same tone that you can use. She does talk very quietly, so you probably won't hear her voice, but you'll at least hear how I'm talking to her.
I've got 2 books. I've got Brand New Baby and See You Later Mum. Which one would you like to read? You're pointing to the book, you say that one. You're using your voice, that one. Good trying. When we read the book, we've got to get that vocal cords out. All right. So let's sit in a relaxed way. Okay, let's go from here. Okay, so we've got to use your big loud voice. Mrs. Arnold. Let's go back. So keep trying, big loud voice. Okay, we've got your vocal cords out, so you can have a stamp, but we've got to get it like a normal talking voice at home, okay? So let's pop your first stamp there. Good job, we're on our way to getting our reward.
In a previous session, she had been using quite a loud voice with me, or not loud, but probably a number 4 talking voice. And she was obviously more anxious that session because she knew there was a video camera right there recording her. So naturally the voice dropped down. So my tone was quite direct and a little bit of that pressure. And I kept making her go back and trying again, which is kind of my message of I'm not going to accept that level of voice or that whisper, we need to keep trying again. And I knew from my relationship with her that I could push her that much. Okay, so another starting out strategy is helping the child to feel comfortable socially at school. So another reason why kids might not progress with a treatment program is they're not enjoying school, they're standing on their own in the playground, they're not joining in with other kids. So I would put this as a priority even before you try and work on communication. So they should be with one, preferably two of their closest friends in all of their classes. So, and if they don't have two that they do talk to or do feel comfortable with, I'd immediately try and prioritise them having play dates with more kids and starting to build those relationships. Sometimes for some reasons, close friends do need to be moved to other classes, which is fine. As I said, you'll then work on building other relationships. But if they don't have to be moved, I'd never use that as a strategy. So there's been times where a school has said, well, she only talks to 2 kids, so we're going to take those 2 kids out of her class next year. And that's a great recipe for entrenching the mutism and then taking another extra year to get that child starting to talk. So wherever possible, make sure they are placed in class and seated near their friends. Obviously, clamp down on any bullying or teasing as soon as you can. Parents might need recommendations from you as to who would make appropriate playdates for this child, and they might need a little bit of help with just starting to organise some playdates. Long playdates, you can let parents know, have a much better effect. So sleepovers are almost guaranteed to get a child starting to talk to another child. But definitely like a whole day playdate, they've got a good chance of starting to talk to that child at home. Starting out again, we want to prioritise that pre-communication stage. So first thing to consider, why is the child so anxious in this situation? So it could be doing sport. So they might be anxious because they don't want to change into their sport gear in the change rooms, or they just don't like attention being drawn to their body, or they might think they're really bad at sport and they don't want kids to laugh. So it's good to try and work out the reasons why they're anxious. Then the immediate strategy is to do what you can to help that child relax. Remove pressure. And remember, this is stage 1 of communication, so you're going to stop all other requests to communicate. So you don't want to be asking them non-verbal questions because that's stage 3 and they're in stage 1. Don't physically move them if you can't help it. So this does often happen where a child is very rigid and stiff and a parent might move them, or they can't join in a game with me and a parent might move their hand. So best not to do that because that's just going to increase their anxiety and make them feel more out of control. So try and give them a warm-up period without any expectations. Validate, I can see that you're really anxious, that's okay, take your time. You might use distraction and chatting as a way to help them relax. They might be allowed to have special items depending upon their age, or even pets do actually work really well. And then you might even set goals for pre-communication. So I can see it's really hard for you to line up each morning and you freeze in the line. So you might set something up like they've got a friend next to them and they hold the friend's hand, but you set that as a goal with a reward. So each time you can line up, hold your friend's hand and then walk up to class, you get a point on your chart. We want to prioritise things obviously like being in class and doing their schoolwork. So if a child is not communicating but they're also not doing schoolwork, all your efforts should be put into strategies to get them starting that schoolwork. So some goals might be specific to the child, of course, but being in the right place, so being on the mat when in group time. Join in just one action of a group game if they're not joining in anything. Join in sport, line up with the other kids, join in activities like music with auxiliary teachers, reaching out to get an object from the table, or go to your safe spot that we've set up when you freeze. So moving on to another starting out strategy, which is educating the peers. So we really want to let peers know that the child can talk, but they're scared to talk. Ask the class not to react if the child does talk. So not to clap, not to make comments, not to laugh. And there's other strategies, obviously choosing age-appropriate ones, such as reading the class a book about selective mutism. getting the child with selective mutism to write a letter to the class, and the child might or might not want to be there when you read the letter. And there's lots of YouTube videos that you could search that might help to explain selective mutism to the class. We need to stop comments from peers. So peers are likely to say things like, "Come on, say hi, you can do it." Or, "Why won't you talk to me? Do you know how to talk?" He can't talk. Or, "I'm the one he's going to talk to first." So clamp down on it. "Josie, stop. Those comments are making Peter feel uncomfortable. Peter will speak when he's ready." So you just want to address them really quickly. I have a funny anecdote of a child who I had been working with whose teacher was actually on extended leave, and the principal was taking the class, and she knew about the child's history but had a much firmer approach with the class than the teacher. She was calling roll, and she didn't expect that he would say anything because he hasn't typically. She called his name, and she heard "here," and she shouted out, "Stop speaking for Jay." And the child smirked because the child himself had actually said "here" for the first time. But he thought that was quite funny, so it didn't actually cause any issues. But that's just an example of where the principal jumped on top of peers that were doing unhelpful things, and she did a really good job. There was a whole culture in the class of peers talking for the child, saying he doesn't talk, and she completely turned that around with being very firm. So you also want to stop peers answering for the child. This is what we call enabling. "Hi Peter, do you have your writing book?" So this is a question to a child where the teacher knows this child can nod, so they can non-verbally communicate. But his friend says, "Yes, it's under his desk." So you need to step in straight away. "Josie, let Peter answer for himself, please." And then repeat it so Peter then can answer himself. So they're the starting out strategies. The next part of the school program is educating all staff. So we call these selective mutism essentials, and they're very different to treatment strategies. I can't emphasise that enough. I always get the question about, "But hang on, you told us to do this, but here you're telling us to do this." And that's because these are blanket basic strategies for all teachers at a school to carry out. And the main purpose of these are to minimise any damage. I facetiously call it damage control. So it's to stop the mutism from getting worse, because some teachers can make it worse by making comments or doing certain things. So it applies to the librarian, the music teacher, all those auxiliary teachers, teachers on playground duty that get a little bit of contact with the child. It's just the basics. So that compared to treatment strategies, which we're talking about today, but after this, is just pretty much for the teacher and a select few other staff at the school. So sometimes the learning support teacher's involved, sometimes the school psychologist. And the aim of those treatment strategies is obviously to build the child's communication and resolve the selective mutism. And it's in-depth knowledge of how to treat selective mutism. So we have made a DVD which is presenting all of those basics for all staff at a school, and it's a 45-minute DVD which is designed to be put on at a staff meeting and played, and it educates all the staff about what selective mutism is and the do's and the don'ts. So that's on that DVD, and I'm going to go through that now. So first of all, they need to understand it's an anxiety disorder. The child's not being stubborn. Pretty much ask limited or no questions at all is even better. Just chat to the child and don't ask questions. If the child's frozen or they're not relaxed, remove any pressure, help them relax, and don't request any communication, not even non-verbal. Give them lots of time to respond. If the child does communicate, you want to let them communicate in whatever way they're using, whatever way they feel comfortable. So there's been examples where I've heard of a child using a recording device to communicate or whispering to a friend, and that's been stopped because it's been thought of as a crux. But if we understand the hierarchy of communication, that's a really important step. So we don't want to take that away, because they're going to go back to being non-verbal, or even you're going to push them back to being pre-communication. So you don't want to be doing this. Stop whispering to your friend in class. If the child does talk, don't show excitement. I'm so happy you talked, that's so exciting. Don't show surprise. Wow, I didn't think you could talk. Don't ask multiple questions. So I've seen this quite a few times where the child does answer a question and you think, wow, this is great. I'm just going to keep on asking, oh, hi, have you got your homework? What level are you on? And who did you work next to yesterday? So every question is going to increase anxiety. And no comments about the fact they've talked, like, you talked. And no prompting for better speech. Can you say that louder? If the child is mute, so again, remember, these are the SM essentials, so just for all staff. It's great to see you today. I noticed you have a lunch order. Hope you enjoy it. So just chatting and making conversation is how people should deal with the mutism. And to never, ever show frustration. Never pressure. Are you going to talk to me tomorrow? I'm a bit deaf, you'll have to speak up. So no tricking. Mind you, I worked with a teacher once who was a little bit deaf, and she used to say that, you need to speak up. Like, she had that great rapport with the child, but great firm approach. You need to speak up. I actually can't hear you. But the whole class did know that she was a little bit deaf, so it wasn't tricking the child, and it worked really well as a strategy. What's your name? So obviously no open-ended questions. You're not answering me. No comments. And when you say please, you can go out to play. No consequences. And that has happened, and it does happen. Not a lot, but it does happen. So moving on to the next part of the school treatment program is the communication sessions. So the school communication sessions, as we call them, is our main strategy for getting a child with selective mutism to start to talk to someone new, such as a therapist or their classroom teacher. And they are very demanding and very intensive, but it's pretty much the only strategy that we know that will successfully and quite quickly get a child to talk freely to the classroom teacher. So it involves setting up 3 15 to 20 minute sessions per week with the teacher and the parent and the child, using a technique called sliding in as the main strategy in those sessions. But there are other things that you can use that 15 minutes for. So at the very beginning of the session, you can play a video recording according to where they are up to on that hierarchy that we discussed before. So the parent gets their phone out and plays the latest recording. That usually only takes a couple of minutes. Once the child is already talking to the teacher after sliding in, you can use those sessions to build direct talking until they're talking spontaneously and longer sentences and good voice volume. And you can use those sessions to generalise talking to others, so to bringing in other kids or going to other teachers' classrooms. So there are 2 pathways to build communication in a child with selective mutism. Starting at the pre-communication stage, the first pathway is where you would work on stage 2, which is talking with the parent alone in the classroom. So some kids can just naturally do that anyway, so you don't need to do anything. But some kids, if you put them alone in the classroom with their parent, they'll still be mute because of the school being that anxious stimulus. So you need to practice that, whether it's a couple of sessions or 3 months or however long it takes to get them to talking with their parent. And then you can move on to sliding in with the teacher and sliding the parent out, so we don't need the parent in those sessions anymore. And then the child is in stage 4. So using sliding in actually does skip a couple of stages in our model. So it skips non-verbal and it skips indirect. So it's a very powerful technique. The other route, so sometimes sliding in can take a long time, and you want to be able to still build communication in the classroom. You don't want to just wait until sliding in works. So in the classroom, you'll move from pre-communication to stage 3, because stage 2 doesn't make quite sense in that respect unless you're just getting them to practice talking to their friend at their desk. So stage 3 being non-verbal with the teacher, then stage 4 being indirect with the teacher using the recording devices or their talking buddy, and then straight to stage 5. So hopefully you'll be using both pathways with getting these kids to talk. If you just rely on the classroom pathway with working through those stages until stage 5, it will probably take a long time. So it may or it may not even work, but I'd say, you know, it could take 2 years until you're getting some sort of direct communication from the child. So that alone is not effective enough unless, you know, you're very intuitive and you're working very, very intensely on lots and lots of repetitions of practicing talking in the classroom every day. But even then, sometimes the child will just be too anxious in the classroom to work on, say, indirect talking via their friends. So that's where sliding in is so powerful, because it's done away from the other kids, just with the classroom teacher and the parent. So before you embark on sliding in, if you need to check, can the child talk to their parent in the room alone? And if they can't, allow them to have regular access to the classroom, and make sure there's no interruptions to the classroom, and try to use the same room that you will use sliding in. They then need to play a structured talking game. Something like Guess Who or Go Fish is a great game. They need to use a reward system like a chart. Okay, and they need to continue that until the child can talk fairly freely to the parent. If they're using their vocal cords within the context of the game, that's good enough, and now you can start sliding in. So it could take one session, or it could take many, many sessions. And actually going back again, if they're taking a long time, I would try and troubleshoot as to why. So one child I'm working with, the classroom has a lot of glass, so it's not very enclosed. So people can potentially see the child while they're playing and talking to their parent, and that's going to increase the child's anxiety. So you need to really problem solve and work out what's going to be the best setup for this child, where people aren't going to walk in the room, they're not likely to see the child. And for this child, using a withdrawal room isn't an option for some reasons, and so we're talking about things like putting a partition between the glass and the child where they're playing on the floor. So sliding in. So we're not going to start sliding in until they can do stage 2 talking. We want the room to be enclosed, undisturbed, just like before. Sitting on the floor, I always do, because I think that encourages relaxation. It's not like sitting at desks. It already sort of seems like an academic environment, same as school when you're sitting at desks. The child and the parent play a game, and the teacher starts outside, and the child has to use their vocal cords in order to get points. So with sliding in, we're not working up from whispering or even from non-verbal. We want to try and get that child using their vocal cords as quickly as possible with the parent. And if they need the teacher to be halfway across the school to do that, that's fine. But if they have done lots of talking to their parent in the classroom beforehand, generally they do tolerate the door being closed and the teacher outside. Trust is very important as well, so you need to have those discussions with the child about how I'm not going to come in without letting you know. I'm going to knock loudly on the door and then pause before I come in. So all those things will help maximise the chance that they will be able to talk to the parent in the room. Then the teacher gradually slides closer until the child's talking to them directly. So we have a stage where when the teacher first comes into the room, they go to the point furthest away from the child. It doesn't have to be their desk, but furthest away, so preferably 2 corners of the room. And they have their headphones on, listening to music, and they let the child listen to the music so they can hear how loud it is. And that's that first step of, I'm in the room, but I'm listening to music and I really can't hear your voice. So the parent actually needs to go up to the teacher and say, oh, by the way, Josie's using her voice, so the teacher knows. So again, no tricking, don't turn the volume down, but you do later as a treatment strategy and tell the child that you're doing that. And so the teacher then gradually takes the headphones off and gradually slides closer to the child as they're talking. The child is required to just keep playing the game using their talking voice, and if at any point it drops to a whisper or they stop talking, the teacher either stops and waits at that point for the child to regain talking in a normal voice, or the teacher goes back a step, whatever is necessary in order for the child to go back to talking to their parent at a normal talking voice. And then they might introduce a sub-step to make it a bit easier, and then keep on moving closer to the child. So an example of where you might need to be imaginative is where I was using sliding in with a child in my room, and I had the headphones on and he continued to talk to his parent, playing the game, using his vocal cords. And as soon as I put the headphones around my neck, he dropped to a whisper and he couldn't regain back to the voice unless I put my headphones back on. So I ended up with my headphones on, sliding closer to him. And I did turn down the volume a little bit, and I ended up playing the game with him with my headphones on, and he could tell by the fact that I was playing the game that I could hear what he was saying. And at that point, when I put the headphones around my neck, he was able to keep on playing. So he just needed just a slight difference in the procedure. So every child will be a little bit different. You have to think on your feet. And throughout sliding in, you want to frequently reward talking. So it's that behaviourism approach of, as soon as you see a behaviour that you like, you praise it, low-key praise, but very clearly, you're doing really great, brave talking. I'm going to put another stamp on your chart. And we slide away the parent eventually, so the child's just talking to you in the context of that structured game. And the duration to speak to the teacher is highly variable, as is everything with these kids. It sometimes only takes one session of sliding in to get a child to talk to someone new. That tends to happen in the clinic more than at school, because the clinic isn't as anxious place as school is. And we tend to, obviously we've worked with hundreds of kids, so we tend to kind of know how to slightly do things differently. So it can be very powerful. But keeping in mind, it also can take many months for a child to speak to you. If we're working with schools and it was taking many months, we'd be problem solving. So I'd be asking, what's the room like? Is the child worried anyone's going to walk in? Is the child worried anyone will see them? What games are you playing? And I've learnt from mistakes. So a long time ago, one school I was working with, the parent and the teacher reassured me that the child was enjoying playing the mathematical games, and I let them continue playing the mathematical games, and he was still not talking to the teacher after a year. So I'm now really tough, and it's like, no academic games, we need to do some really, what we think are fun games, really help the child relax. Okay, so I'm going to show you another role play video. So it's my son playing the role, a little bit younger than he was in the last video. So he's not doing as great job of acting like an anxious child. So generally you'll see selective mutism kids will be a little bit more rigid and not so relaxed and moving about. And by the end of the session, he even says something spontaneous to Simone, the therapist, which is a little bit unusual. You wouldn't tend to see that. So this is a perfect example of what sliding in can look like. So we haven't done any steps where we've had to go backwards at all, but it's to show you, if it goes perfectly, this is what it looks like.
What we're going to do now is Leo's going to practice being brave. So I have a game here called Guess Who, and what I want you guys to do is basically I want you to play the game, just the two of you, and I'm going to leave the room. And Elizabeth, what I want you to try to do is try and encourage Leo to use his normal voice, just like you hear at home. When you notice that he's comfortable and he's relaxed and that he's using his normal voice, I want you to come get me, because I'm going to be outside the room. And again, what's going to happen is, as soon as you notice Leo's brave and he's using his normal voice, he's just going to get a tick on his chart. Does that sound okay?
Yeah.
You understand?
Yeah.
Excellent.
Okay. Who do you want to start? Me or you? You? Okay. So you asked me a question about my person. Can you try and ask? Do you want to whisper? Yeah? You whisper. Does my person have a hat? I'll put the people with glasses down. Okay, you'll go. You try and whisper to me from there, okay? Does my person have white hair? Okay. Okay. You ask me now. See if you can try with your normal voice.
Is your person a girl?
Is my person a girl? No, not a girl. You'll go.
Is your person have a little nose?
Yes, my person has a little nose. How many are you going to put down? That's going good. Okay, now you know what? You've been doing such a good job of using your normal voice the last few times. I'm going to go and let someone know because I think you're going to get a tick on your chart, yeah? Okay, so I'll go out and I'll let her know.
Yeah, he's been doing really well,
Oh,
talking
brilliant.
and using his voice and playing in the game.
Okay, brilliant. Let's give him another tick. Wow, Leo, your mum says that you've been so brave and you've been using your normal voice. That's amazing. I think you deserve a tick for your chart. What do you think? Yeah. Good job, Leo. So what's going to happen next is I'm going to be outside again, but the door's going to be a bit open. So I might be able to hear you guys play. But again, Elizabeth, when you hear him using his normal voice, you could just come and get me.
Okay.
And I'll come give him his next tick.
Sure.
Great.
Blue eyes. No, my person doesn't have blue eyes. Okay. Just wait one moment. I just want to tell someone. Yeah, he's been doing great. He's
Awesome.
been using his normal voice pretty well.
Brilliant. So let's give him a tick. Yeah, Mum says you've been using your normal voice. You've been really brave. That's incredible. Well done. I think you deserve another tick. What do you think? Good job, Leo. You might be getting that lightsaber soon. So Leo, what's going to happen now is I'm going to be at that desk over there, but I'm going to have some headphones in with some really loud music, so I won't be able to hear a thing. And what's going to happen, Elizabeth, if you can tap me on the shoulder when you think Leo's using his normal voice,
Yeah.
and I'll come back again and give him a tick.
Okay. Sounds good.
Sound good? Great.
All right. Does your person have brown hair?
No.
Oh, brown hair. Okay. So I'll put brown hair down.
Does your person have a big nose?
Big nose. No, no big nose. Okay. You're doing so well, Leo, at playing the game. I'm going to go and tell Simone. Simone, Leo's doing really well at using his voice and playing the game.
Well done, Leo. You're doing such a great job. I think you can get another tick for your chart. What do you think? Excellent. So this time I'm going to be at my desk, but I'm not going to have headphones on. So when he's again using his normal voice, if you could just look over me and I'll come give him another tick.
Okay.
Okay, sounds good.
You okay? I know it's hard, I know harder to talk now, but see if you can keep on playing.
Does your person have little lips?
Little lips? Yes, little lips.
Is it okay if I just sit here and watch you guys?
Sure. Does your person have a moustache?
Yes.
They do. Ooh, okay.
Does your person have glasses.
No glasses.
I'm just noticing Leo's doing such a good job using his normal voice, and I've just been giving him some tics as I'm noticing it. Elizabeth, is it okay if I take your spot? And I think he's just doing so great. So is it okay if I take your spot?
Yeah. Where do you want me to go?
If it's take a seat on the chair and just watch us. Okay. Okay, Leo. I think it was my turn or your turn. Which one did you think? You can tell your mum.
Which one was it, Mum?
I don't know. I
Probably
think...
my turn.
Okay. You have a go.
Does your person have... Is your person a girl?
Girl? No. A good question.
Does your person have a hat?
Yes, he does have a hat. Good question. Elizabeth, if it's okay, do you mind if you maybe go outside? I think he's doing great.
Okay, sure.
Is your person George?
Yes, how did you guess?
That's the only one I've got opposite. And my person is...
Don't tell me. Your person must be Alex. Good job. I think you can get your last tick. You know what that means? You get a lightsaber. Should we go show your mum? Okay, let's go bring your mum in and tell her how well you've been. Elizabeth, Leo just wants to show you how well he's done on his sticker, on his star chart.
Okay, so there was a step in there which we don't tend to do much anymore, the step where the door is open. So in our busy clinic, if there's people in the waiting room, that door leads directly onto the waiting room, so it just doesn't work. And so same, I can imagine in the school environment, if you open your classroom door that you're doing sliding in, there's tons of people walking past. So that's not going to be a helpful step. If you do have a room where the door open then leads to another room where no one is in there, then you could use that as a step. So that was, as I said, he wasn't presenting exactly like a very anxious kid would do, and there was a bit too much spontaneous talking at the end there that you wouldn't typically see, and the voice volume also tended to be quite a bit louder as well than you would typically see. Okay, so in terms of what games you would use for sliding in, any fun game that does encourage structured talking, very easy academically. So if you're reading a book, for example, make sure you give one well below their grade level that they feel 100% confident with. Later, sure, once they're reading regularly to you, you can give them grade level books and assess and whatever. But while they're starting to talk to you, we're using this as a strategy for their anxiety, so it needs to be easy. So headbands is good, Guess Who, Go Fish, Zingo, Spot It, where you have to just name one word, and Battleships. And we tend to just rotate between those same games. Life after sliding in. So what happens once you've done sliding in like that and the child can talk to you within the context of the game? It doesn't mean they'll say anything to you in the classroom during the school day. You'll often find that it's just during your communication sessions that they can talk during a game. So the things that you want to do is to build that direct talking to you, which we'll go through in detail in a moment, to undo the habit of non-verbally responding. You saw a little bit of that in my video with the child where she was nodding. So that's her habit. She's been doing it for years. So I'll tell you how to undo that habit in a moment. And then generalise that direct talking to more and more kids and other teachers and the canteen and other school situations. You may need to use that sliding in strategy with other peers. So I've once had a parent do this, had an aide, and I've had teachers all use a strategy where they would be playing a game with a child in a room, and one by one they bring in a different peer. I've even sometimes gone to schools where I've done that. So I've got the child with selective mutism and a pack of UNO cards, and we've worked out a hierarchy of peers that he doesn't talk to, and I've got them to send each peer in one by one, and we've played a little bit more UNO with each peer. And a small number of kids might require that building sounds strategy. And you might find that they do much better when their parent's no longer there with them. So send the parent away once they're talking to you and keep on building talking. Once they have talked to you in the context of a game, like in that role play video there, you'd then start asking forced choice questions, but keeping in mind that they still might only be able to answer them in the communication sessions with you. If you try and then ask a forced choice question in the classroom, you've got all those other variables in the classroom, like all those other kids that might just hear me talk or might see me talk, all those variables that are going to make it more anxious for the child to talk. But you might, in your communication session, play a game and then ask a forced choice question about the game. Or something I like to do is ask them, do you want Star Wars or Pikachu on your next reward chart? So something that's a little bit motivating for them and they're interested in. So it could be about the activity or the game, and then later about other topics. You know, is your lunch from home or canteen today? The other things that you'd be wanting to work on is increasing the length of their sentences until they're using full sentences, moving from structured tasks to less structured tasks, giving opinions and personal information, making spontaneous comments. We've got strategies to do that I'll talk about later. Building their volume like we talked about before, and assertiveness, like telling you when there's a problem, asking for help. So sometimes we need to do role plays with asking for help. So some of the activities we use to build that direct communication and spontaneous talking are sentences on pieces of paper that they pick out of a bowl. What's your favourite food? So that's starting to ask about favourites, and so they would answer it, maybe using one word or a sentence, and then they'd read a sentence back to you. Rory's story cubes are great, so you roll the dice and there's pictures on them, and the child needs to make up a story using those pictures. This would be one of the most advanced techniques for these kids, so very difficult stage 5 talking because it's spontaneous talking to you. Hangman is a good easier one. Go Fish Fairies is good because every card has a fairy on it, so they need to describe the card. So do you have the card with the fairies in the boat and the frog? And jokes, so reading jokes, it's structured, but it's a good way to start to, it's a fun way to build structured talking. And then scavenger hunt is a technique that we use a lot. So you can buy My First Scavenger Hunt for Kids, and I tend to get the child to pick their favourite 9 cards, and then I make a copy of them. And that copy goes everywhere. So they not only do it with me, but they then ask these same questions to their teacher, and then every other teacher, and the office staff, and the librarian. So for example, they would just say, can you find something furry? Can you find something bendable? Can you find something soft? Can you find something round? And so the other person has to find something. So it's really good for generalising to other people. So while you're building direct communication with the teacher, you want to try and avoid a non-response from the child. So you can choose questions that you know that they're likely to answer, giving them lots of time to respond, such as 10 or 15 seconds. Repeat the question, or provide prompting. So that's okay, take your time, I know you can do it, or even a specific prompt, like say yes. And then if the child still doesn't respond after using those strategies, then change one of the variables that you've learnt about that makes it easier for the child to respond. So if you've asked a child to say an answer to their friend next to them, and you say, tell Bob what you got for question number 2, and you wait the 10 seconds and they still don't respond, you might do something like take a walk around the classroom, and you'll say, I'm just going to go away, and when I come back, Bob can tell me what you've said. And then you'd come back and see whether they have been able to tell Bob the answer. So some other strategies that you could use to make it easier for them. This could be any of those variables that we talked about previously. So change the task to a more structured task. ask the person to look away. So the teacher or the new teacher that they're talking to, you could ask them to turn away. Let's say you're generalising, they're talking to the librarian and it just wasn't working. You could say, oh, do you mind just turning away slightly while they say that again? And so overall, just thinking of those many, many slides that we went through that are the variables of communication, they're the things you're going to be manipulating at this point to get the child to more likely to talk. So I really like this strategy of breaking the non-verbals, because this is the point where it's more about breaking a habit. The child is able to talk directly to you, but they just so automatically shrug or shake or nod their head. So you only use this once they have been talking single words to you. So it could be in your communication sessions, they've started talking within the context of the game, and then you ask them a question and they nod. You then wouldn't allow that non-verbal response ever. So you would label it. So you'd say, you're nodding your head, say yes. You're pointing to the book, say that one. You're shrugging your shoulders, say I don't know. So you'd label the action that they're doing to bring their awareness to it, and then you'd tell them what to say. And you might need to do that 20, 30, 40, 50 times. They might need an extra prompt originally. So I was giving you examples of that extra prompt. You're shaking your head, say no. But later on, the child will only need you to say, you're nodding your head. And they then realise, oh yeah, and they say yes. And eventually you get to a stage where you go, you're, and then the child says yes. So it's quite nice to see that process being undone. So here's an example of how you might build talking with a teacher. So first of all, you might do your sliding in with the child and parent in the room. You slide the parent out like you saw in the video. Then you might quickly change to a scavenger hunt. So you might say, okay, I've got this scavenger hunt. The parent might be back in the room because it's a slightly harder task. And then you finish the scavenger hunt, and then you might go to your desk and you might say, I'm just going to make you up a chart for your next reward chart. Do you want a Pikachu or a Star Wars chart? And you're looking at the pictures. I generally Google, some pictures or charts, and they can see them right then and there. So their motivation is really high, and they might point, and you might then label the nonverbal. So you might say, you're pointing to the Star Wars chart, say Star Wars. So it ended up being a forced choice question with a specific prompt. But then next time you ask something similarly with a forced choice question, they might be able to answer straight away. And then more labelling nonverbals, as I just said. So back to the school treatment program, that was talking about the communication sessions. So now we're going to talk about generalising talking. Keep in mind when you're trying to generalise the child's talking to other people, to try and only change one of these three variables at a time. There's the activity that you're playing, which could be, say, scavenger hunt, the situation that you're in, which would be the classroom, and the person, so you, if they're doing it with you. So you don't want to suddenly, if they're playing scavenger hunt with you in the classroom, sounds a bit like that Cluedo game, you don't want to then play Guess Who with the librarian in the library, because you've changed the activity, the situation and the person all at once. Okay, so also, a good technique to start to generalise their talking is to work out what's the child's hierarchy of different people. So I generally write down all the kids' names in the class. I try and get access to the first names and maybe some other people that are relevant, like a parent helper, an aide, another auxiliary teacher. And I cut them in strips and I get the child to order them from easiest to hardest on the floor, and then I take a photo of them. And if I do that in my session, I'd then email that to the teacher and I'd say, this is their hierarchy, do you want to start working on it? But you could do that yourselves as well, or you could ask the parent to do it. You just need to give access to what the names are. And then you'd work with one at a time. You could include them in sliding in, or you could use a structured task like scavenger hunt. And you'd work with John. If John is really easy to talk to, or if he's a talking buddy, then don't worry about John. You then work on the next child and then the next child. And I have, like I discussed before, when I went to the school and played Uno, I have had a successful sort of session where we've gone through about, say, 10 kids in a whole session. Or similarly, I've visited a preschool before where we would do a structured game or sliding in with the preschool teacher, and then we've slid in about 10 different kids. And I can generally get through about 10 kids in half an hour. So it's not a new game every child, but it's quickly changing. As the child speaks to one, it's like, great, okay, get out, next child, come in, and then you keep on moving through, like a production line. The other way you can generalise talking is manipulating where you seat the child in class and the small groups that you put them in. So at the start of treatment, you're using seating and class groups as a way to increase their comfort and to maximise the chance they're going to start talking in those groups. But later, you're going to start manipulating them as a treatment strategy. So initially, child might be sitting at a desk with their two good friends and maybe some slightly less familiar kids. And once they're talking at their desk, you want to take one of those good friends away and move a new friend next to them that they're only slightly familiar with. And then once they're talking at that table, then you quickly swap. So you're swapping in and out kids to eventually get the child talking to every child in the class at their desk. Another time that you might use that is thinking about who you're going to put the child with in maths groups, reading groups, and so on. So if you're working on selective mutism, it's okay to pick, say, a slightly lower level for that child, so a slightly lower reading group, if it means being put with a friend. If at their reading level group there's their own friends, great. But if at their own level reading group there's no friends and there's no talking, put them down a level, get them at least talking first, and then you can later manipulate who's in those groups. So you don't have to sacrifice the other children in the class, but you can sacrifice the academics of the SM child. Later they'll end up in their right group. And then the other situations you want to generalise talking to are the really hard ones, like going to see the principal, showing them their work, saying something structured, doing news, talking at assembly, and ordering from the canteen. So here's a case example of, so this was one child I was working with, and just something, series of steps that they did during a school visit. So they did scavenger hunt in a small enclosed room with their teacher. We brought in the teacher's aide and they did scavenger hunt with them, but their voice dropped to a whisper. So we asked the aide to turn around. The child was still whispering and the child couldn't bring their voice up to a normal voice, even though it was a very structured task. So we changed from scavenger hunt to a very easy book, which the child had always sort of learnt that this helps me to get started when I'm reading an easy book. So by changing to the easy book and with lots and lots and lots of prompts, use a number 4 voice, use a number 4 voice, she was able to start using her number 4 voice with that aide. And then continued to read the book while the aide slowly turned around and was able to face the child while she read. And then we switched back to the scavenger hunt with the aide and she was able to continue using her vocal cords. The aide then asked, and we'd primed the aide to do this, asked some forced choice questions to the child and she was able to answer using her vocal cords. And the aide labelled some non-verbals. You're nodding your head and the child was able to then turn it into a yes. And then this particular child, as she went out of the room, walking down the corridor with the aide was asking some forced choice questions, and the child continued to use her vocal cords answering those questions. So that's changing the environment to the corridor with this new person that she'd never spoken to before that session. So that was quite good progress for that particular child. I want to also read you an email that I received from a teacher's aide once, different aide, just to show everyone working together at a school to help this particular child and how they were working on generalising the child's talking to the canteen. So she said, I thought you'd like to know that Ted, who was in Year 6, managed his first shift in the canteen. So this was a child who actually hadn't been talking to any kids in his grades at that point. So it was a really big step. He was supposed to do the lunch shift but was too nervous. Jack, who's the canteen contractor, and I convinced him to try again at recess. So there's that kind of gentle pressure. And you would have been so proud of him. He took several deep breaths and worked with Jack to serve several students. Jack was great. He was Ted's voice initially, so obviously the child couldn't speak initially when someone came up and the canteen guy talked for him. And then Ted started to relax and was able to serve independently. It was beautiful to watch. I rewarded him with a special set of Yu-Gi-Oh cards, which was his special interest. So that's just an example of, I was amazed that they'd all come together. To make something like that happen, you have to have fairly intuitive sort of aides and even the canteen guy who know enough about the anxiety to know how much to push and what are appropriate goals. And you can imagine as he stood at the canteen to serve his first kids and didn't talk and was mute, some people might want to kind of let him off and go, oh, that's okay, we'll try again another day. But they didn't. They thought of something like, well, the canteen guy would talk for him and you need to stand here and, try and relax. And so that helped him push through. So the next part of the school treatment program is using step ladders in the classroom to build anxiety. So this was that second path that I talked about, where we're moving through the 5 stages of communication within the classroom. And we use this because sliding in may be slow, or you've used sliding in, but it hasn't generalised to the classroom. So the child is still mute all day in the classroom, even though they can talk to you in the communication sessions. So we want to use those step ladders to go from, generally there'll be stage 3, non-verbal, right up to stage 5, with the teacher in all of their classes and in every school situation that you can think of. So remember those 5 stages that we talked about? We're moving through these stages. And how do we do that? So you need to think about every single classroom situation or activity. So when he's in reading groups, what's his communication like? What would be an appropriate goal for him to work on in reading groups? Okay, I'm going to talk to him one-on-one about that and tell him what I expect him to do. So it could be, we're going to work on you reading a passage in reading groups, but I'm going to tell you what that passage is and you can go home and you can rehearse that passage, and then that will be the exact one that you need to do. Or you might decide he can't do that yet, so you might actually put him in a different reading group where there's more familiar kids. Or there might be one child who he is really finding it hard to talk to in that reading group, so you might move that child out. So you're aware of which stage from 1 to 5 they're currently in that situation. You're choosing a goal, you're discussing it very openly with the child when you're one-on-one, and if necessary, doing role plays. So when you're working on things like asking for help, it's great to do one-on-one role plays that seem a little bit silly, but you practice what to do, putting your hand up for non-verbal or saying, whispering help please, and you practice doing that one-on-one over and over again, and then you try and move it into the classroom. So when you talk about goals with the child, you're talking very directly and very clear with what you'd like them to do. Lots and lots of practice. So, and you would be working this into your day with how you work with this child, just like The child who's got ADHD, you're doing things differently with them. You're breaking down your instructions and giving one at a time. So with lots of kids you're working with differently, and same with the selective mute child. Praise should be low key but as immediate as possible. Like, that was great telling Bob, you got number 2 for that question. And obviously building it into a reward system as well. So points, tally marks in the front of their book, which then add up to larger rewards as well. If their anxiety is too high or the goal is too difficult, you just make an easier goal. And once the child does a goal easily, quickly move on and push it up to a harder goal. It's also helpful to get kids to rate how hard a goal is. So if you're not sure, if you're asking them to do something that's too hard, introduce a rating scale. So it could be 5-point rating scale, or older primary might just have a 10-point. You might not even have to show them something visually. You could just say 10 fingers. So this is an example of a 5-point that you might use with kindy first or second graders, or even third graders. And with preschoolers, we use the bears cards and label them number 1 bear, number 2 bear, number 3 bear, number 4 bear. And you would just say to the child, this is my idea of a goal that I'd like you to work on in class. What number out of 5 is that? And if they're rating it a 2 or a 3, then they're letting you know it's hard, but they think that they can do it. And if it's a 4 or a 5, I'd be saying, okay, you're letting me know that's pretty hard. Most often they'll choose 5 because they really want to make sure you know this is too hard, I can't do it. And you say, okay, you're letting me know that's too hard. Let's have a think about a way to make that goal a little bit easier so that you can do it. And then you'd problem solve, change the variables, make it slightly easier. And the situations that you can work on communication goals are pretty much any situation at school, during roll call, with you one-on-one in the classroom at your desk or at the child's desk, and so on. We've talked about lots of those situations. So going back to stage 2, building communication with their talking buddy in class. Some kids will do this easily, so you'll see them talking to their friends at their desk. Great, they've achieved stage 2 with those friends anyway. But if they're not, if you know they can talk to kids in the playground, or 1 or 2 kids, and they're not talking in class, they really need to work on this stage 2 in class. So that's where you need to give them lots of opportunities. So place them with those friends that they can talk to. Give them explicit permission so they know they're not going to get in trouble. It's okay to talk to your friend in class. Mind you, I did have a question before, and some kids end up talking too much, and you do need to address that behavioural issue. So you can talk to the whole class about when it's okay and not okay to talk, or you can pull the child aside and talk one-on-one about when it's okay and when it's not okay to talk. And seating in class, it's best to seat them where the fewest number of kids are going to be looking onto them, so that they feel comfortable talking. So teachers are generally relieved when I say that, because everyone's always saying the kids with ADHD and behavioural problems need to be at the front of the class, but the SM kids need to be pushed down the back generally. And these are a whole lot of examples of different goals that you could set in class and what stage of communication they are. So I won't go through them all, but some examples might be email a voice recording to your teacher once a day. That's an indirect stage 4 goal. Answer teachers' questions by typing on an iPad and pressing play, so using that Speak It To Me app. That's stage 4 as well. Play your speech on iPad to the teacher and to friends, because they're not yet ready to play it to the whole class. That's a stage 4 goal as well. So there's lots of different examples of goals. And there's also an example of a step ladder for presenting news. So if you're doing news or speeches with your class and you want the child to be involved, you might need to start with a very simple pre-communication goal, which is just standing in front of the class while the teacher reads their news to the class. And you'll eventually work up towards the top step, which is presenting news to the class verbally. And for presenting news, we use recording devices often. So playing speeches on mum's phone to the class or just to the teacher. And then here's an example of a stepladder for asking for help. Now, these stepladders you wouldn't necessarily show the child, so it's not like other anxiety disorders where you say, here's our 10 steps to working on your anxiety. This is just something you either might never draw up, but you'd just have it in your mind, and you'd gradually work through the steps. And the child would only be told the current goal that you're working on. So it could be, I want you to whisper help to your talking buddy, and you can cup your hand around your mouth, that's okay. And I'm going to give you a specific prompt by saying whisper help to James. So it's as specific as that. And once they get good at that, you'd then move to the next step. And the final step, final part of the school program is talking about rewards. And I always get the question about shouldn't a child be internally motivated to work on these things? And I always say, think of your greatest fear again. So, you know, I think it's really important that you face this fear. Public speaking is one of the most common fears. So just go out there and speak. There's only 2,000 people, you can do that. So who's likely to do that unless you're going to get some sort of reward? You might get, well, you might not do it at all. You might get paid for it. You might know that it's actually going to promote you in your business or whatever. So reward systems work for these kids. You won't always have to do them, but the times that I've seen kids not progress well have been the times where they haven't had a reward system. And it doesn't have to be something that embarrasses them in front of the class. It could just be as simple as those tally marks in the front of their book. But they do need the immediate points as soon as they're doing something that's at that zone of difficulty for them. Very open praise, but very low emotion. And telling them exactly what you're happy with. So good saying yes, or great using a louder voice when you said help please. So you're reinforcing that it's louder. The points always add up to larger rewards, and if they don't finish, if you're using a chart with, say, 12 boxes and they haven't finished all 12 by the end of that day, you still use the same chart, so you never take away the points that they've earned and start again. Use meaningful rewards, so they don't have to cost money, they can just be social rewards or rewards in the classroom. You can get the parent to deliver the rewards, but they will work better if you use school-based rewards. And the child being embarrassed with praise and getting rewards is actually quite common and not a reason to stop and avoid them. So sometimes parents will say they get really embarrassed when I praise them, so I've stopped. It's better to push through that and the child will get used to it, as long as it's low key, it's not over the top, and it's very accurate praise. So I want to show you an example of an email that I received from a teacher once. This wasn't even a teacher who was getting treatment from our clinic, but she was so enthusiastic and excited about reading some information about selective mutism. She then implemented her own strategies in the classroom. It was a kindy kid, so she's more likely to respond quickly. And she wrote to me, "Hi Elizabeth, what a difference a week makes. I work Thursdays and Fridays. Our little girl started whisper talking to some of the girls on Wednesday, and she's broken herself away from the little boy she was previously glued to. I introduced a reward book on Thursday. Stickers are earned when she whisper talks to one of the kids or signs to an adult. She goes into our office, takes her book out of her magical golden bag, puts a sticker on and then brings the book back to the teacher. She loved the book and it was such a delight to see a smile on her face for most of the day. It was a real positive. She received 11 stickers on day 1. I expressed my concern to her that I may not know if she needs help with the stickers. Sometimes they won't peel off the sheet. I suggested she could use the Macaton sign for help and proceeded to show her this. So this teacher taught the Macaton signs to actually a lot of the kids in the class. I asked if she could show it back to me, which she did. She was also able to put her hand up for the roll today and was using the sign "thank you" with me all day. Very exciting stuff, she writes in bold and capitals. I'm so pleased I listened to my instincts, as Mum has since added that her little girl will not talk to her in the classroom, in the school grounds, or in the car on the way home. She has to be inside her home before she'll talk. That's beyond shy. So I think the parent had said she's just shy, and the teacher had thought, this is beyond it, we need to do something. I've attached a photo of the magical golden bag, reward book, and stickers in use just for your interest and in case you wanted to show any clients that the strategies don't have to be fancy to work. So I do think that's fancy, even if she doesn't, and you don't have to do things as elaborately as that, but with a preschooler or a kindy kid, it certainly would work very well if you did have the energy and time to do something like that. Charts could just look like this. You can download them. The chart on the right is the one that we would typically use and I'd choose pictures of the child's interests, and they just need to fill the boxes to get the reward. Or if you don't have time, just using a stamp, and every time the child does a goal, just stamp on the chart, and then you could even use counting at the end as a structured task, and you write down how many stars they've got. So that's reward systems, and we're coming to an end of the talk. So I have a list of different resources, like books about selective mutism for both teachers and parents. There are a range of storybooks that you can read to the child or read to the class, different ones to suit different ages. So don't read Danny the Duck with No Quack to a high school kid. And then there's some general anxiety resources. So the Macquarie University Cool Kids program is great for teaching a child with selective mutism about anxiety and teaching them some strategies to change their thinking. The Brave online program is a free online program for both parents and children with working on anxiety. Please Explain Anxiety to Me is a great book that describes the physiology of anxiety, so how their body feels. And Tiger Tiger Is It True talks about the importance of their thinking and why their thoughts are making them more anxious. And then there's the DVDs of the clinic. So the What All Staff Need to Know About Selective Mutism is that in-service DVD. It's not in-depth treatment strategies. It's just to educate all staff at a school. The treatment for selective mutism in schools and preschools is the same as today. So if you ordered that, you would get today's seminar. The treatment for selective mutism in high schools is almost exactly the same as this seminar, but suited for kids in high school. And then the preschoolers with selective mutism transitioning to school is only short, 1.5 hours, and it's just about how to aid the transition to school. It's not about the in-depth treatment strategies, but it's strategies to work on orientation, how to prepare the school to minimise the child's anxiety when they get into the school, building rapport with the teacher, and so on. And then there's a range of different websites and Facebook pages as well. And that brings us to the end of the seminar.